Back we are with the political director for the Organic Consumers Association, and we are looking at, well, our whole health care system, which, frankly, as people who listen to the podcast know, it is, from my point of view, a disease maintenance system. It has nothing to do with health whatsoever, although we're being promised a whole lot. Thank you for joining me today, Alexis. I appreciate it.
Oh, thanks, Dr. Steve. I think that's a great way to describe the problem.
So let's take a look at this healthcare system. Can we make it healthy? I would think that if we're looking at healthcare, we got to change our nutrition concepts. Don't you think that's a really big first step?
Absolutely. I mean, what we're offered to eat in this food system is not healthy. A lot of it isn't even safe. There are 76 million cases of food poisoning reported every year. 300,000 people go to the hospital, and 5,000 people die each year because of the food poisoning that mostly comes from the factory farms. And then, you know, we're consuming all of these GMOs, subsidized crops. We're consuming way too much high fructose corn syrup, too many trans fats, which is the GMO corn, canola, and soy oil. And then all the meat and eggs and dairy is also coming from factory farmed animals that are fed those same things. So almost everything in the American diet is based on GMO corn, cotton, soy, and canola. And it's no wonder that 34% of us, nearly 100 million people, are obese. Not even just fat, we're obese. And it's costing our healthcare system $147 billion annually. And that doesn't even mention, you know, diet-related diseases. If you just look at heart disease, it cost the U.S. $503 billion. That's what it's expected to cost the U.S. in 2010. So we've got a very sick system. And then when you get into the healthcare debate, nobody wants to pay for this sick system. It certainly can't profit a for-profit health insurance industry. So they're trying to pass the buck. But the solution that our government has so far come up with is this idea that every American should be required, forced, to buy into this for-profit healthcare system that, you know, isn't really keeping us healthy. Like you said, it's a disease maintenance system. It's, you know, you go into the hospital and you're likely to pick up one of these infections that can't be treated by antibiotics because most of the antibiotics in this country, 2/3 of them, are going into our food supply, contaminating our water, and then creating superbugs that can't be treated in hospitals. So we've just got the most grotesque system, and until we turn it around and start going organic and, you know, basically just outlawing these factory farms that are responsible for most of the disease and illness in this country, you know, it won't matter who pays for it. Nobody will be able to afford the healthcare costs of this system.
Well, you know, you're right. Everything that we do with our system is aimed at profit, has nothing to do with physical overall healthfulness. And if occasionally I hear from people about, you know, I'm picking on the conventional medical system. Well, when you take a look at how much we spend, $2.5 trillion every year, well, at least last year, $2.5 trillion. The rest of the world, if you put all they spent on healthcare in a pile, it would only be $1.3 trillion.
Wow.
So we outspend the rest of the world 2-to-1, and nowhere in any measurable way are we getting our money's worth. They're looking at diabetes doubling by the year 2025. Chronic diseases pandemic, not just in older people, but in young people. And for the first time this year, it now looks as though the children born from the year 2000 forward will not live as long as their parents.
God.
Now, tell me on what level this system is successful. And just jumping on insurance companies ain't getting it.
Yeah.
So the big winners are the corporations as usual. And the only way that we're going to do anything, make any change, it starts from the bottom up, not the top down. Change your life. Change you. And that's the reason why I have Alexis on every week with me from Organic Consumers, because they are promoting education. They're changing your paradigm. You take charge of your life. The rest will take care of itself.
Yeah, it's a sad system.
And I appreciate you informing us. Thank you for spending time, as usual, and enlightening us. Alexis Baden-Mayer from the Organic Consumers Association. We will talk again about 1 week down the road.
Thank you, Dr. Steve.